Hello everyone, my name is Dr. Elizabeth Kolawole, and here are my 2 cents on bacterial vaginosis. Everything that I discuss is backed by the most recent research, but I will give a disclaimer and say that these videos are not to replace being seen and evaluated by your own medical professional. These videos are for educational purposes only and should not be used to evaluate, diagnose, or treat any ailments. So, in honor of Women's Month in March, today we are going to talk about bacterial vaginosis, the most common cause of vaginal discharge in women of childbearing years. So, what is bacterial vaginosis? It is defined by 3 changes in the vaginal environment. 1. It is a shift from good vaginal bacteria, namely lactobacillus, to bad bacteria called facultative anaerobes, which means the bacteria can use oxygen or not depending on the environment. 2. These bacteria produce substances that decrease lactic acid production, which can subsequently cause smell and symptoms of bacterial vaginosis. Thirdly, bacterial vaginosis is defined by increase in vaginal pH of the vagina above 4.5. So the vagina becomes more alkaline, and this can cause a host of problems. Next, what are the risk factors? The risk factors for bacterial vaginosis include sexual activity, race and ethnicity, diet, and body mass index. Okay, let's get started with sexual activity. It should be stated that bacterial vaginosis is not, I repeat, not a sexually transmitted disease, but sexual activity can increase the risk of obtaining BV. You can get bacterial vaginosis without having sexual intercourse, and you can get a recurrence of bacterial vaginosis without having sexual activity, which makes it different from trichomonas, gonorrhea, and chlamydia, which are STDs and do cause vaginal discharge. Having other STDs does put you at risk for bacterial vaginosis, especially herpes and HIV. So bacterial vaginosis is not an STD, but having sex puts you at risk for getting bacterial vaginosis. In females who have sex with females, bacterial vaginosis is highly prevalent in up to 50% of female same-sex relations. Now, race and ethnicity. Bacterial vaginosis is more common in African American women, then in Mexican American women, and lastly, in white women. Douching and cigarette smoking put you at risk for bacterial vaginosis, but maintaining a diet rich in folate, vitamin E, and calcium decreases the risk of bacterial vaginosis. The last risk is body mass index. The heavier you are, the more at risk you are to obtain bacterial vaginosis. Now let's get into symptoms. It is important to note that 70% of women with bacterial vaginosis will have no symptoms, and many articles recommend not treating these women because they will spontaneously get better on their own. For those who do get symptoms, you will likely see vaginal discharge, vaginal odor, usually a fishy smell, which is more noticeable following sexual intercourse and menses. And other consequences of bacterial vaginosis include preterm delivery, postpartum fever, inflammation of the endometrium of the uterus, post-hysterectomy vaginal cuff cellulitis, and post-abortal infection. Treatment includes by-mouth metronidazole or vaginal metronidazole, as well as by-mouth clindamycin or vaginal clindamycin. So you can use either metronidazole or clindamycin. And because bacterial vaginosis is caused by a growth of bad bacteria in the vagina, to prevent bacterial vaginosis, you can take a daily probiotic to give your body and vagina a dose of good bacteria, such as lactobacillus. I am Dr. Elizabeth Kolawole, and here are my 2 cents on bacterial vaginosis.